Good afternoon, everyone, and thank you for joining us for our weekly update. I'm pleased, as always, to be joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in the region of Peel. I don't know about you, but I, for one, am looking forward to the Labor Day weekend. I wanted to take the opportunity to thank all our frontline healthcare workers, our police officers, paramedics, firefighters, and healthcare workers, our My Way drivers, and all those in the service industries who are working hard this weekend. They've done an incredible job throughout this pandemic and deserve our thanks. With Mississauga in stage 3 for just over a month now, we continue to monitor cases with an average of 7 new daily cases over the last week. In Peel, the majority of transmission is isolated to households and workplaces, meaning that one person is testing positive, they're passing it on to multiple people in the same household or close family members at social gatherings, and subsequently to their colleagues at work. While Peel Public Health has been contact tracing since January, the launch of the new provincial system allows them to track those interactions more closely and break the chains of transmission. Speaking of contact tracing, I encourage everyone to download the COVID Alert contact tracing app. It's free, it's anonymous, and it will help protect us all. While public health is planning for a resurgence, we must do all we can to stop cases from creeping up again. Dr. Lowe asks that we continue to do our part by practicing COVID-19 prevention by limiting proximity, duration, and numbers when it comes to social gatherings. Practice the core 4 behaviors. Wash your hands, keep a safe physical distance, wear a mask, and don't touch your face. I saw an ad today for a pumpkin spice latte, which can only mean one thing. Summer is quickly coming to an end. Next week, school begins for some students in our Catholic board, and our public school students will start the following week. Many workplaces are starting to implement a gradual return, and we are approaching flu season. With all of this comes a lot of talk about the possibility of a second wave. I want residents to know that Peel Public Health and Trillium Health Partners are ready and prepared to respond. To date, they have conducted nearly 120,000 tests and have the capacity to ramp up those efforts this fall. We have learned many valuable lessons from the first wave of COVID-19 here in Peel. In March, we knew very little about this virus, but 6 months later, we know much more, and as a result, we are better prepared. In the months to come, public health will also focus on working with childcare providers and school boards to ensure that schools can safely reopen and stay that way by keeping on top of infection prevention and control. And thanks to the province, we will have a team of public health nurses in our schools to help support our students and educators with those efforts. While the situation has vastly improved in our long-term care homes and in the shelters, the possibility of a resurgence in those settings is a distinct possibility. We cannot keep our eye off the ball or blink for a second. Public health will be using the lessons learned from the first wave while implementing the provincial directives to keep our loved ones safe. They will also continue to encourage people to get the seasonal flu vaccine. Given the symptoms are very similar, we will need to work as hard as possible to prevent cases of the common flu, to ensure testing remains easy and accessible so we can quickly delineate the difference between the two. So please, once the seasonal flu vaccine becomes available, please consider getting one. Overall, we have been doing really well with thanks to the efforts of our residents here in Mississauga and to everyone right across the GTA. By no means do I want to scare residents, but it is so important that we are realistic about the possible challenges we could face this fall. Most importantly, I want you to know that we continue to take this very, very seriously and that we are ready to respond. Here at the City, we continue to carefully and slowly reopen facilities and programming. In addition to our recreation centres, fitness centres, indoor pools and arenas, City Hall will also reopen its doors to the public in a limited capacity beginning on September the 8th. This Tuesday, we will begin by offering marriage and business licenses, including those for mobile operators such as taxis, tow trucks, or food trucks at City Hall, but by appointment only. And council chambers and committee rooms will reopen with limited capacity. So please, do not show up at City Hall or any of our community centres without an appointment and a plan. It's best that you check the hours and availability first by visiting mississauga.ca/recovery or by calling 311. Once again, I want to thank our staff for their efforts to ensure a safe reopening and for working closely with Peel Public Health and the province to make it happen. Before I turn it over to Dr. Lowe, I wanted to briefly touch on our recovery plans and specifically how this pandemic has hit our small business community. Last weekend, I had the opportunity to tour several small businesses in downtown Cooksville, Malton, and in Streetsville with the Mississauga Board of Trade, our local BIAs, and Tourism Mississauga in support of the Canada United Weekend. It was great to see our downtowns bustling with activity and businesses welcoming their customers back again. While things are starting to pick up, many owners told me that they're worried about making ends meet and their ability to keep their doors open until the holidays. We cannot forget that many storefronts were closed for months at a time. Without revenue coming in, bills have begun piling in along with rent. Many are struggling to pay their employees and outfit their operations. And while they are thankful for the tax deferrals the city has been able to provide and the support from the federal and the provincial governments through the Commercial Rent Assistance Program, they're telling us they need longer and more sustained support to ensure that they can survive 2020. The GTHA mayors have committed to continuing to listen to the needs of small businesses and working with our local BIAs and chambers of commerce to help our small business communities thrive. I also understand that the federal government recently extended their interest-free loans for small businesses and nonprofits through the Canada Emergency Business Account Program until the end of October. They also have plans to expand eligibility to make sure it's more flexible and works better for business owners, all of which is good news. Here in Mississauga, our economic development team continues to roll out our short-term and long-term recovery plan, and Tourism Mississauga is forging ahead with Mississauga Made, our very own Buy and Shop Local campaign. The next time you are out shopping, I ask that you please consider to buy and support local. If you see a Mississauga Made decal in the storefront, make an effort to pop in and say hello, and if you can, buy something to show your support. And with that, I will now turn it over to our Chief Medical Officer of Health, Dr. Lawrence Lowe, to provide us with a brief update. Thank you.
Thank you, Madam Mayor, and good afternoon, Mississauga. As of noon today, Peel Public Health has investigated 3,127 cases of COVID-19. Of these, 87 are active, 2,810 have resolved, and 230 have passed away. Across the region, I have been heartened by residents who have taken my message to heart. While we will almost certainly see some sort of resurgence in the fall, how much of a resurgence is up to all of us. I encourage Mississaugans to not let the low case numbers lull you into a false sense of security. We're not tilting at windmills here. On the contrary, COVID-19 is very real, and we have seen how it has climbed up elsewhere quickly when given a foothold. Peel Public Health continues to work with healthcare partners to test, trace, isolate, and treat where transmission does occur. We continue to work with long-term care, congregate settings, workplaces, childcare, and schools to ensure that precautions are taken as we move into the fall. But all of us have a part to play in stopping transmission in the first instance. Sticking to the core four of distancing, masking where that's difficult, hand washing, and staying home and getting tested when sick remains crucial. Recent cases in the region of Peel and in Mississauga have been related mostly to travel as well as family and social gatherings. While this was somewhat expected in moving to stage 3, it's a reminder that this pandemic is far from over. Some important reminders. Reconsider travel outside of Canada in line with federal recommendations. And if you do have to travel abroad, self-isolate for 14 days after returning. That means being on your own, apart from others, even within your own household. Don't bring COVID home as a souvenir for your loved ones. Our contact tracers have seen even how breakfast and coffee between a returned family members and others in their household can lead to transmission. Isolation is the safest place to keep you and your loved ones safe for those 14 days on your return. Please don't go to gatherings if you are sick, even in the least. Here's what COVID loves: some with mild symptoms, heading into work, lunching with friends, and then having dinner with grandma, all while ignoring distancing. The end result is dozens of exposures, dozens of potential new cases, and perhaps some of those to hospital. When sick, the priority is to get tested and self-isolate. You can also get your flu shot this fall, download and activate the COVID-19 Alert app, and remember that social circles are meant to be 10 people, exclusive to each other in close contact, and beyond that social circle, limiting proximity, duration, and numbers will help you stick to the core four, reduce risk, and stop spread. Now is unfortunately not the time for indiscriminate bear hugs, singing around a campfire, or movie nights on the couch. Beyond your circle, you never know. I don't share these reminders to stoke fear, but rather to explain and to empathize. Know that we can still see each other. We can play games, do business, spend time together. We just need to do it differently to keep COVID out. I know it's not fun. I too long for the freedom to sing and dance while fueled with good food and drink. But given the chance to connect in person now, even with precautions, I will take that and do it right to keep that option open, rather than risk having to head back virtual and online. Let's save the celebrations for the right moment. Right now, it's important to do our part to mitigate any resurgence and the hard work that we need to do together to keep everyone safe while keeping our community open. Thanks for all you're doing, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. As you can see, the stakes are high, and we must remain laser focused on our efforts to limit the severity of a second wave this fall. I'd like to close by wishing the thousands of students across Mississauga a great first day back at school. Geez, I can remember those days with my own children. Yes, school will be very different this year, but nonetheless, it's an exciting time for students, parents, and teachers alike. Back to school also means more people on our roadways. As students head back to the classroom, I ask drivers to please keep your eyes peeled at all times. Be vigilant, follow the rules, obey signs and speed limits, and slow down in school zones. Distracted driving is a major concern in Mississauga. Many of us have been spending a lot of time at home and not driving as much as we usually have. We're also not used to seeing students out walking, biking, or being dropped off at their schools. So please, keep the phone down and keep your eyes on the road. Our goal is not only to keep the students safe in the classroom, but on the roadways too. Have a great first day back, whether it's virtually or in person. And of course, happy Labor Day weekend, everyone. I will now take questions from the media. Thank you.
Mayor Crombie, your first question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Hi, Mayor Crombie.
Hi, Ashley.
So earlier today, a report came out that said the Alcohol and Gaming Commission of Ontario is going to be issuing more licenses to cannabis retailers in the fall and going forward. So I'm wondering if now that things are getting a little bit more back to normal, when the city is going to revisit the idea of allowing private cannabis retailers to set up in Mississauga.
Thank you, Ashley, for the question. Certainly that was going to be a report we were going to review back in March and April, but of course with the pandemic, we've had to put aside regular business and just focus on the important matters at hand. So I think that it may be too soon this fall, certainly later this fall or first quarter next year, we'll turn our minds to it once again. It is a subject matter that we do want to revisit at this time now that we've had more experience in other jurisdictions.
Thank you. And my follow-up question is, I know that there's been a lot of talk and reports over the past few months about how big a deficit the city is going to face as a result of the lockdown. And I know that the city is going to be getting some much-needed help from the provincial and federal governments. But is the city exploring any other sort of more creative ways to maybe make up the shortfall over the next few years? And in particular, I'm wondering if the city is or would ever consider asking the province if it would be able to impose something like its own land transfer tax in the future.
So as you recall, Ashley, we have a $107 million deficit, $47 million or so that we have mitigated ourselves, leaving us with a $60 million deficit. We're very grateful for the Safe Restart program from the federal and provincial government. We've been given $46 million, $15 million to cover some of our operating deficit, and the $31 million to cover our transit deficit. We will have an opportunity as well to reapply next year in a phase 2 for continuing mounting deficits, which we could face in the area of transit if people don't return to if we don't return to 100% capacity. Certainly, revenue tools is a topic of conversation we always have with our provincial counterparts. As you know, we're always been asked to build 21st century cities with 19th century tools. At a minimum, we have asked the province to give us the same suite of tools that the City of Toronto has and let us decide which of those tools is appropriate in each of our cities.
Mayor, your next question comes from Khaled from My Second Home TV. Khaled, please go ahead.
Hi, Mayor Crombie, how are you?
Welcome, Khaled.
Thank you. Last month, the city launched a survey about noise. And can you please update it on the feedback and what are we gonna do in this regard?
Yes, so we are reviewing our noise bylaws. There was a draft that came forward to Council, and Council strongly believes that further public consultation is required. So before we voted on the amendments and recommendations to the noise bylaw, we feel that we need to take it out for further public consultation. So we are at that point right now, Khaled, so that report will go out to the different communities, and the public will have an opportunity to give us feedback on the recommended changes.
Very well. My follow-up is not a question, but it's a complaint from a group of residents here, especially in the area of Eglinton and Ridgeway. This area has been a field for drag race, all kinds of, unfortunately, sometimes accidents not reported, and huge noise, distraction, and everybody, and what all kinds of converted cars. Not even once the police showed beside the regular infractions on the road. What's your say on that?
So unfortunately, it has been a common theme, Khaled, and I live very close to Lakeshore Boulevard. We hear it there, Dundas, Burnham Thorpe, the same. The police have done as much due diligence as they can, as when and if it is reported by 311 or to our non-911 police numbers. They are very quick to follow up. They have the Erase program, of course, which deals with speeders to reduce the number of infractions. As you know, there was a very successful sting operation in one of our large outlet malls where people were gathering to drag race, and many of those were arrested. So we continue to be on it, and I encourage you and all the residents to continue to call the hotline numbers, whether it's 311 or Peel Police.
Thank you.
Thank you.
Crombie, the next and last questions are actually for Dr. Lowe.
Thank you. I'll invite Dr. Lowe back to the podium.
Dr. Lowe, we have Isaac here. Isaac, please go ahead.
Hi, Dr. Lowe, can you hear me?
Hi, Isaac. How are you doing?
I'm good, thank you. This morning at your Brampton press conference, you were asked a couple of questions about school reopenings, and in your answers you relied specifically on the provincial framework. But obviously Peel region has its own picture of the virus. There are particularly high case counts. And so I want to press you to be specific about any measures you would take in Peel schools to either put extra recommendations in place or ask stricter measures in the classrooms. Will you be taking any action like that?
Yeah, Isaac, it's a really great question. At this time, it's really premature for me to speak to it. As I mentioned at the press conference this morning at Brampton, we have just shared that geographic data with the school boards, and ultimately, given that the school boards are taking these decisions, I would not want to speak prematurely before we've had a chance to really land on what measures we would be taking with them.
Okay, so does that mean that a lot of the emphasis then will be on the school boards to make those calls rather than yourself? And if that's the case, why the school boards, since it's Peel Public Health who has the expertise in the virus?
So we work very closely with the school boards, and we have been making advice and recommendations throughout this pandemic. You'll recall, Isaac, that we've actually advised them that they should consider making masks required for students between grades 1 through 3. And so some school boards have considered that and taken it on. But ultimately, the running of the school boards and the reopening process, it was made very clear to me that we were to bring the local public health expertise and understanding of our context, but that the reopening was ultimately being run provincially by the Ministry of Education and directed by the school boards who have the operational mandate to open the schools. Thank you very much for the questions.
Thanks.
This concludes today's press conference. On behalf of Dr. Lowe, I want to thank everyone for participating. Have a great day. Stay safe. See you next week.